12 Ugly Things Seniors Do as They Age That No One Tells You. Dr. Daniel Hayes. Good morning, and prepare for a revelation that might just shatter your conventional understanding of aging gracefully. It turns out that a significant portion of what we believe about aging well is not just inaccurate, but dangerously so. Today, I aim to unveil 12 common behaviors exhibited by seniors as they age. Practices that are often overlooked or deliberately unaddressed by healthcare professionals, well-intentioned family members, and even the colossal pharmaceutical industry. These are the unspoken truths that can silently erode one's health and vitality. Some of these habits are embarrassing, others are alarming, and the very first one, which I will reveal at number 1, is something that the vast majority of individuals over 70 are doing without realizing it, a habit that is actively and insidiously shortening their lives. My name is Dr. Daniel Hayes, and prior to dedicating the last 2 decades to the intricate world of geriatric medicine and surgical care, I harbored my own assumptions about the aging process. However, my extensive interactions with thousands of patients, ranging in age from 60 to 92, have illuminated a truth that is both messy and uncomfortable, a truth that seldom surfaces in polite conversation. A pivotal study, meticulously conducted by the National Institute on Aging and involving over 14,000 adults aged 65 and older over a 12-year span, yielded staggering results. It was discovered that an astonishing 91% of participants were unknowingly engaging in at least 4 distinct behaviors that were actively accelerating their physical and cognitive decline. These 4 detrimental habits were quietly working against them, day in and day out, and they remained entirely unaware of their corrosive impact. It is precisely these clandestine forces that we will be dissecting today. Before we embark on this journey of discovery, I invite you to participate in a personal reflection. Please share your age in the comment section below, and enlighten us with the one aspect of aging that you feel no one adequately prepared you for. I genuinely value each and every comment received on this channel, as your insights have the potential to inspire future content that could profoundly benefit others. Now, let us commence our countdown from 12 to 1, with the revelation at number 1 poised to fundamentally alter your perception of your own body. At number 12, we confront a practice that I witness with disheartening frequency in my clinical setting, a behavior that never fails to pierce my heart. This is the insidious, gradual withdrawal from social connection. Seniors often retreat so imperceptibly that the damage is substantial by the time it is recognized. It typically begins with seemingly minor omissions, missing a dinner invitation, letting a phone call go unanswered, or convincing oneself that tiredness, introversion, or a simple lack of inclination is the sole reason. However, the scientific evidence paints a stark and sobering picture. Researchers from Brigham Young University, after analyzing data from over 3 million individuals, concluded that social isolation carries a mortality risk comparable to smoking 15 cigarettes daily. Imagine the equivalent of 15 cigarettes a day, purely from loneliness. Following the age of 65, the brain experiences a more rapid decline in the production of oxytocin and serotonin, the vital chemicals responsible for bonding and happiness, than in any preceding decade of life. Social interaction functions akin to lubrication for a complex engine. Without it, not only do the components slow down, but they begin to grind against one another, fostering inflammation. Cortisol, the primary stress hormone, then begins to spike chronically. Persistent elevation of cortisol, as extensively documented in research from University College London, has been shown to shrink the hippocampus, the brain's crucial memory center, at nearly double the usual rate. I recall a patient, Margaret, a 78-year-old woman from Boise, Idaho. Following the passing of her husband, she spent 14 months virtually confined to her home. Upon her presentation to me, her cognitive scores had plummeted significantly, her blood pressure was dangerously elevated, and she expressed a profound sense of fading away. We implemented a straightforward social prescription, 2 community events per week, and a daily phone call to a friend or family member. 8 months later, her inflammation markers had subsided, her blood pressure normalized, and she poignantly remarked, a sentiment I will forever cherish, "I feel like I've come back to life." Connection, unequivocally, is a potent form of medicine. Let no one persuade you otherwise. At number 11, we encounter a habit that elicits nervous laughter from my patients as they readily acknowledge their complicity. This is the tendency to consume the same foods day after day under the misguided notion that dietary routine equates to optimal health. While I understand the allure of simplicity, comfort, and familiarity, nutritional monotony in seniors represents a silent catastrophe. After the age of 70, the body's capacity to extract essential micronutrients from food diminishes by as much as 40%, a consequence of reduced stomach acid production, a condition known as hypochlorhydria. Therefore, when one subsists on a narrow rotation of foods, the deficit extends beyond mere variety. It actively creates significant nutritional deficiencies within an already compromised absorption system. Research emanating from Tufts University's Human Nutrition Research Center on Aging revealed that seniors exhibiting low dietary diversity were a staggering 62% more prone to significant muscle loss, cognitive deterioration, and immune dysfunction compared to their counterparts who incorporated a wider spectrum of whole foods into their diets. The mitochondria, the minuscule powerhouses within each of our cells, depend on a dynamic assortment of vitamins, minerals, and phytonutrients to function effectively. Providing them with the identical fuel source daily inevitably leads to sputtering and decline. The practical solution is remarkably straightforward. Each week, consciously introduce one food item that you have not consumed in the preceding 2 weeks. Diversify your protein sources to include fish, legumes, eggs, and lean poultry. Vary your vegetable intake by color: orange, dark green, red, purple, as these distinct pigments signify different protective compounds. To enhance the absorption of fat-soluble vitamins A, D, E, and K, pair your meals with a small quantity of healthy fat, such as olive oil or avocado. After 65, variety transcends mere spice. It becomes the very bedrock of a healthy existence. Number 10. A point that invariably surprises individuals upon their initial encounter with it highlights the prevalent tendency for seniors to excessively rest after physical exertion, a practice that insidiously degrades their muscle tissue. It is imperative to clarify that rest is not inherently detrimental. Indeed, it is absolutely essential. However, a phenomenon known as anabolic resistance escalates significantly after the age of 60. Anabolic resistance, in essence, signifies that our muscles become recalcitrant, failing to respond to normal recovery signals with the same efficacy as a younger body. A 30-year-old might recuperate for 2 full days following exercise and emerge stronger. Conversely, a 70-year-old who observes the same 2-day rest period may actually experience a decline during that interval. Studies originating from McMaster University in Ontario have demonstrated that older adults require more frequent, albeit lower intensity, bouts of movement between rest days to sustain muscle protein synthesis, the critical process by which the body constructs and repairs muscle fibers. Consider it analogous to a campfire. A younger individual can allow the flames to dwindle for 2 days and then easily rekindle them. However, a senior requires the consistent addition of small pieces of wood to prevent the fire from extinguishing entirely. The practical recommendation here is to embrace what researchers term active recovery. This involves engaging in 15 to 20 minutes of gentle walking, light stretching, or resistance band exercises on your non-exercise days. Avoid transitioning from intense physical activity to complete stillness. The directive is to keep the fire of your metabolism burning. Your muscles, your metabolic rate, and your bone density will all express their gratitude. At number 9, we delve into a subject that is profoundly personal and rarely discussed openly in the confines of a doctor's office, which is precisely why I feel compelled to address it here. This pertains to the widespread habit among seniors of drastically reducing their water intake, often without conscious awareness, due to a significant diminution in the sensation of thirst that accompanies aging. What is particularly alarming about this is the scientific evidence. Research published in the Journal of Gerontology indicates that by the age of 75, the thirst mechanism in the human brain can become up to 40% less sensitive than it was at 40. Consequently, the body is becoming dehydrated, yet the brain is no longer effectively signaling the warning. Chronic, mild dehydration in seniors accelerates joint deterioration, impairs kidney filtration efficiency, thickens the blood, thereby increasing the risk of stroke, and, most disturbingly, it can mimic and exacerbate the symptoms of dementia. I have encountered patients referred for suspected cognitive decline who, quite simply, were not consuming adequate water. Re-establishing proper hydration restored a remarkable level of mental clarity within weeks. The recommended daily intake for most seniors is 6 to 8 glasses of water, but the timing is of paramount importance. Consume a full glass immediately upon waking, before your morning coffee or any other beverage, as the body loses significant fluid during the overnight hours. To optimize hydration, pair water intake with electrolytes, particularly potassium and magnesium, which tend to decline with age. These electrolytes aid cells in absorbing and retaining water, preventing it from simply passing through the system. Water-rich fruits such as watermelon and cucumber, as well as herbal teas, contribute to your daily fluid total. If necessary, set a phone alarm as a reminder. It is crucial to drink before you feel thirsty, as the sensation of thirst indicates that you are already in a state of dehydration. Number 8, a topic that has elicited palpable discomfort during discussions among physicians in conference rooms, addresses the significant under-advocacy by seniors in medical settings. They frequently accept diagnoses without probing questions, fill prescriptions without inquiring about alternative treatments, and depart from appointments with lingering confusion, rarely seeking further clarification. The ramifications of this passive approach are severe. A study published in the Journal of Patient Experience revealed that seniors who actively participated in their own medical decision-making experienced a 34% improvement in health outcomes over a 5-year period when compared to those who passively deferred to their healthcare providers. Your body at 70 is not the same as your body at 45. Medications that were once appropriate may now be unsuitable. Dosages require adjustment, and interactions between multiple drugs, a condition termed polypharmacy, the concurrent use of numerous medications, can precipitate compounding issues that not every physician has the time or capacity to meticulously monitor. After the age of 70, the liver and kidneys process medications more slowly, resulting in drugs remaining in the system for extended periods and at higher concentrations than the original dosage was designed for. Therefore, before each appointment, meticulously jot down your questions. Whenever possible, bring a trusted individual with you. Specifically inquire, is there any medication I am currently taking that could be deprioritized or substituted with a lifestyle intervention? You are not being difficult, you are acting as your own most effective advocate. This singular habit possesses the potential to add years of quality life to your existence. As we progress to number 7, entering territory that often elicits the greatest surprise, we confront the quiet epidemic of seniors oversleeping. While you have likely heard the opposing advice throughout your life to obtain more sleep, that rest is healing, and this remains true to a certain extent. However, research from the American Academy of Sleep Medicine has found that adults over 65 who consistently sleep more than 9 hours per night exhibit a 37% higher risk of cognitive decline and a significantly elevated risk of cardiovascular events. More is not always better. The physiological rationale behind this lies in the fundamental alteration of sleep architecture, which encompasses the stages and cycles your brain traverses during sleep after the age of 70. Deep sleep, the most restorative phase, decreases. The body attempts to compensate by spending more total time in bed, but this extended duration is primarily spent in lighter, less regenerative sleep stages. The mitochondria within your brain cells are particularly reliant on efficient deep sleep for cellular cleanup, a process known as autophagy, which is essentially your brain's overnight waste removal system. For most seniors, the optimal sleep window is 7 to 8 hours, not 9 or 10. If you find yourself struggling to stay awake in the evening and consistently sleeping beyond 8 hours, this could be an indicator of vitamin D deficiency, thyroid dysfunction, or anemia, all common and treatable conditions in older adults. It is crucial to discuss this with your physician. Excessive sleep is not a manifestation of laziness. It is frequently a symptom that warrants thorough investigation. Before we delve into our top 6, I would like to briefly pause and request that if this information is proving illuminating, please take a moment to click the like button and subscribe to this channel if you have not already done so. We are dedicated to producing medically grounded content focused on senior health on a weekly basis, and your support is instrumental in maintaining the accessibility of this vital information to all who require it. Now, let us continue. Number 6 is a phenomenon I observe most frequently in patients over 75, and it stems from the most benevolent of intentions. This is the abandonment of strength training, predicated on the belief that it is inherently dangerous, inappropriate, or simply too demanding for one's age. I wish to state this as directly and as kindly as possible. This conviction represents one of the most physically detrimental misconceptions in senior health. Following the age of 65, the human body experiences a loss of 1 to 3% of its muscle mass annually, a process termed sarcopenia. After 75, this rate can escalate to 5% per year in the absence of resistance training. Muscle is not a matter of vanity. It is your metabolic engine, your safeguard against falls, your regulator of insulin, and the very cornerstone of your independence. Research conducted at the University of New Mexico demonstrated that seniors who engaged in resistance training twice weekly maintained their bone density, preserved their balance, and reduced their risk of life-threatening falls by as much as 40% when compared to those who exclusively performed aerobic activities. I had a patient, Harold, an 81-year-old gentleman from Tucson, Arizona. He sought my guidance after sustaining his second fall in 18 months, relying on a cane, and harbored a firm conviction that his body had simply reached its limit. We initiated a gentle, twice-weekly resistance band program. 18 months later, Harold had relinquished his cane, gained 9 pounds of muscle, and confidently asserted that he felt stronger at 81 than he had at 75. The human body consistently responds to demand, irrespective of age. You simply need to present that demand. Number 5 addresses an area where the wellness industry profits substantially from perpetuating confusion, and it pertains to vitamin D and its intricate relationship with what researchers now term the master hormone of aging. After the age of 60, the skin's capacity to synthesize vitamin D from sunlight diminishes by approximately 50%. Simultaneously, the kidneys, responsible for converting vitamin D into its active, usable form, become markedly less efficient. The inevitable outcome is that an overwhelming majority of seniors are living with chronic vitamin D deficiency, even if they regularly spend time outdoors. Vitamin D deficiency in seniors has been linked in studies from Harvard Medical School to increased rates of depression, accelerated bone loss, compromised immune function, and, alarmingly, a 40% higher risk of dementia. Herein lies the crucial connection to what researchers identify as the master hormone of aging. Vitamin D directly regulates the production of testosterone and estrogen in older adults, both of which experience a dramatic decline with age, and both of which are fundamental for muscle maintenance, mood stability, cognitive acuity, and cardiovascular health. The practical recommendation is to request a 25-hydroxy vitamin D blood test from your physician. Most seniors require between 2,000 and 4,000 international units of vitamin D3 daily. However, it is critically important to always pair it with vitamin K2, as K2 plays a vital role in directing calcium to your bones rather than allowing it to accumulate in your arteries. Furthermore, consume your vitamin D supplement with your largest meal of the day, as vitamin D is fat-soluble and absorbs significantly better in the presence of dietary fat. This single, well-implemented correction has the potential to yield palpable improvements within 8 to 12 weeks. Number 4, and we are nearing the pinnacle of our list, concerns a habit so pervasive among seniors that it has almost assumed the status of a cultural expectation. This is the drastic reduction of protein intake as appetite naturally wanes with age. Seniors tend to eat less, and when they do reduce their food consumption, protein is almost invariably the first nutrient to be cut. The biological consequence of this decision is nothing short of catastrophic for the aging body. Due to the aforementioned anabolic resistance, older adults actually require a greater quantity of dietary protein per pound of body weight than younger adults, not less, in order to maintain the same rate of muscle protein synthesis. Research from the University of Arkansas for Medical Sciences recommends that adults over 65 consume between 1.2 and 1.6 grams of protein per kilogram of body weight daily, a significantly higher intake than the general adult recommendation. When seniors become protein deficient, the body initiates a process known as catabolism, wherein it begins to break down existing muscle tissue to salvage the amino acids necessary for basic survival functions. Imagine a building owner stripping copper wiring from the walls to sell for immediate cash. You are, in essence, cannibalizing your own bodily structure. This leads to accelerated weakness, immune suppression, delayed wound healing, and a profound fragility that can render a simple fall a life-altering event. It is advisable to distribute your protein intake across all meals rather than concentrating it at dinner, as the aging gut can effectively absorb and utilize approximately 25 to 40 grams of protein in a single sitting. Prioritize leucine-rich proteins such as eggs, fish, dairy, and legumes, as leucine is the specific amino acid that most powerfully stimulates muscle protein synthesis in older adults. Following protein-rich meals, engage in a brief 10-minute walk to enhance nutrient uptake and insulin sensitivity. This is not merely an optional supplement, it is a fundamental aspect of structural maintenance for your body. At number 3, I urge you to reflect deeply on this point, as it touches upon something profoundly psychological that extends far beyond mere nutrition or exercise. This is the silent, pervasive habit of seniors surrendering their sense of purpose, retiring not just from their careers, but from a sense of meaning in their lives. Research conducted at the Rush Alzheimer's Disease Center in Chicago, which tracked over 1,500 seniors for 7 years, revealed that individuals with a strong sense of purpose were 2.5 times less likely to develop Alzheimer's disease and lived an average of 7 years longer than those who reported feeling purposeless. 7 years, stemming from something as intangible yet profound as meaning. When purpose diminishes, the prefrontal cortex, the brain's command center for decision-making and personality, begins to lose stimulation and literally shrinks in volume. Concurrently, inflammation throughout the body escalates as the immune system loses the regulatory influence of the brain's positive engagement circuits. I recall a patient, Eleanor, a 72-year-old woman from Portland, Oregon, who retired and, within 18 months, developed significant depression, early memory lapses, and chronic joint pain that defied conventional medical explanation. We collaborated to help her identify a new purpose. She began mentoring young women in her former profession 2 mornings a week and cultivated a small container garden. Within a year, her inflammation markers normalized, her memory scores improved, and her pain had decreased by over 60%. Eleanor confided, "I didn't realize I had retired from myself." Discover your reason to greet each morning. Protect it with fierce determination. It stands as one of the most potent medicines known to scientific understanding. At number 2, and I promised earlier that this revelation would be startling, so brace yourself. This pertains to the near universal habit among seniors of breathing incorrectly. I mean this in a specific physiological and measurable sense. Chronic, shallow chest breathing, a default pattern for almost all adults by their 60s, reduces oxygen delivery to the brain and tissues by as much as 20% when compared to proper diaphragmatic breathing. Research from the Cleveland Clinic has demonstrated that shallow breathing chronically elevates cortisol levels, increases systemic inflammation, raises blood pressure, and diminishes heart rate variability, a key indicator of cardiovascular resilience. Following the age of 65, respiratory muscles weaken, lung tissue loses elasticity, and the diaphragm, the primary breathing muscle situated beneath the lungs like a dome, becomes underutilized and consequently weakened. The resultant effect is that most seniors operate on a reduced oxygen supply every hour of every day without their awareness. The brain, which consumes 20% of the body's oxygen despite constituting only 2% of body weight, suffers first and most acutely. Cognitive fog, fatigue, anxiety, and poor sleep are all amplified by this silent oxygen deficit. The intervention is remarkably simple, requiring no equipment or prescription. Diaphragmatic breathing practice, inhaling slowly for 4 counts, allowing the belly to expand rather than the chest, holding briefly, and exhaling for 6 to 8 counts. When practiced for just 10 minutes daily, has been shown in trials at Massachusetts General Hospital to measurably reduce blood pressure, lower cortisol, improve sleep quality, and enhance oxygen saturation in older adults. Incorporate this practice upon waking, before meals, and whenever you experience feelings of anxiety or fatigue. The air you are already breathing can be a more effective healer if you learn to breathe it correctly. And now, we arrive at number 1, the single most detrimental practice that seniors engage in as they age. This is the habit that the medical system rarely confronts directly, the practice that insidiously undermines every other healthy habit you may have cultivated. It is the habit of accepting pain as an inevitable consequence of aging and subsequently ceasing movement because of it. I am not referring to catastrophic pain that necessitates immediate medical evaluation. I am referring to the chronic aches, the stiffness, morning joint discomfort that seniors universally interpret as a signal to slow down and remain still. And that interpretation, I need you to hear this with absolute clarity, is physiologically backward. Synovial fluid, the lubricating substance within your joints, is not maintained passively. It is actively produced and circulated through movement. When you cease moving due to joint pain, you are essentially starving the joint of the very fluid that alleviates that pain. Consider it analogous to a squeaky hinge. Most individuals stop opening the door because of the squeak, but the actual solution is lubrication, and movement is the lubricant. Research from Johns Hopkins Arthritis Center has found that gentle, consistent movement can reduce joint pain in seniors by as much as 47% over a 12-week period, often proving more effective than anti-inflammatory medications and without the gastrointestinal and cardiovascular side effects associated with those medications. Beyond the joints, chronic inactivity stemming from pain avoidance triggers what researchers at Stanford University have termed an accelerated aging cascade. Within 72 hours of reduced movement, muscle protein synthesis slows, insulin sensitivity declines, cardiovascular efficiency decreases, and inflammatory cytokines, the chemical messengers of inflammation, begin to accumulate in tissues. A single week of significant inactivity in a senior can require 3 to 4 weeks of consistent movement to reverse. And the longer this pattern persists, the more challenging the reversal becomes. I had a patient, George, a 74-year-old gentleman from Nashville, Tennessee. Knee pain had compelled him to abandon his morning walks 18 months prior to his consultation. During those 18 months, he had gained 22 pounds, developed prediabetes, experienced significant muscle loss, and, paradoxically, his knee pain had worsened despite the reduced activity. We commenced with water walking, a gentle form of movement in a pool that reduced joint load by up to 80% and progressed over 4 months to dry land walking, followed by light resistance training. George subsequently lost the excess weight, reversed his prediabetes, and his knee pain is now a 3 out of 10, a significant improvement from the 8 out of 10 that had previously curtailed his life. Movement was the prescription, not rest. Movement. Here is the crucial takeaway from today's discussion. Aging is not a passive experience that simply happens to you. It is an active process in which you participate, for better or for worse, with every conscious choice you make each day. The 12 points we have discussed are not indicative of character flaws. They are understandable, deeply human responses to a body and a world that are undergoing change around you. However, the capacity to understand them, to name them, and to consciously choose differently is unequivocally within your power, irrespective of your age or current circumstances. I have witnessed remarkable transformations in patients in their 80s. I have observed individuals reclaim their independence, vitality, joy, and purpose at ages when the world had seemingly written them off. It is never too late, not at 70, not at 80, not even at 92. The human body possesses a remarkable capacity for forgiveness when provided with what it genuinely requires. Your quality of life is not a predetermined destination, it is a direction, and you possess the agency to alter that direction today. If this video has provided you with valuable insights, I implore you to subscribe to this channel immediately and activate the notification bell so that you never miss our weekly publications. Please leave a comment below, sharing which of these 12 points surprised you the most, and do include your age. I genuinely read every comment, and your stories hold immense significance for me. All scientific references pertaining to the information presented today are conveniently linked in the description below. Please share this video with anyone over 60 who you believe would benefit from hearing this message. And I eagerly anticipate our next encounter. Take exceptional care of yourself, for you are undeniably worthy of it.